Hi, my name is Jamie, former addiction counselor and person in recovery. Today we're going to talk about therapist ethics and patient confidentiality. Can a therapist's anonymous story about a patient ever truly be anonymous? I've been thinking about this a lot lately because what happens when a patient hears their own story in a TED Talk or Instagram or TikTok or YouTube and they recognize that it's their story? And I'm not talking in generalizations. I am talking maybe this person is sharing the story with very nuanced vocabulary or very nuanced conversations that maybe you had with your therapist in therapy, and you recognize them on social media or TV or wherever you see them, and you hear them sharing those details. And even though they don't say your name, how do you think it would make you feel? Now, I know this has been controversial. I did a video the other day, and some people were kind of like, well, if they don't say my name, I don't care. But I do think that this is situationally dependent, because what if it was something to do with extreme trauma? And then what if we're talking about not just one video, but multiple videos? And I did do a video kind of explaining the backstory about why I've started this conversation. So if you haven't seen that, it's one of my earlier videos. Go check it out. So, on one hand, sharing case studies can help train therapists and reduce stigma. But on the other, even with names changed, patients can often spot their own stories. And maybe it's a unique trauma, a specific relationship dynamic, or that oddly specific detail, the nuance that I was discussing. Maybe something like that is going to give it away. And when that happens, it doesn't just break trust, it can actually re-traumatize some patients. I'm not saying this is the case for all, but it does happen and it can affect some patients. Here's what I'm torn about. Is there any way to share therapeutic stories ethically? Could a composite work, or should we stop altogether? I would love to hear your take, especially if you're a therapist or a patient who's experienced this. I am only speaking from my opinion on this matter, which we will get to momentarily, but I do think that it's important that we hear all voices on this topic. I get why therapists do this. Case studies are powerful teaching tools, but here's the thing. We don't own our patients' stories. And even with consent, power dynamics between a therapist and a patient can make it really complicated. So if a patient says, yes, I'm okay with sharing, is it truly voluntary? And I think that really depends on time and healing, and that's a whole other conversation we can talk about at another time. I think it just really depends. But most people in therapy, especially if they're in maybe trauma therapy or addiction therapy, those are going to be your more vulnerable people. So are they really in a condition to give consent if they did give consent? Would they be afraid to say no to their therapist if they weren't comfortable with them sharing their story? And then what happens if the therapist just decides, I'll go ahead and share this story and I won't say the name and maybe I'll change some of the details, but I'm still going to share the story? Is this an ethical dilemma, a moral dilemma, or no big deal? Let's be real. When we anonymize, we often really suck at it. We think changing a name or a location might be enough, but trauma fingerprints can be more identifiable than we admit. And even in something like addiction counseling, which was my specialty, sometimes the trauma that is discussed, even in those settings, can be more identifiable than we admit. And I just don't really feel like it would be appropriate to share, especially if you are a newer therapist, whether you're at the master's level or doctoral level. I do think that anybody with maybe less than 10 years of experience should probably not be trying to anonymize somebody's story. I know I've discussed Dr. Romani before, but I think she does this in a very educational way, and she does this in a very anonymized way. I've never heard a specific dialogue when she's discussing the story. So she speaks generally about narcissism and narcissistic personality disorder, but I can tell you that listening to her talk, it's very educational. It's not an anecdote or a vignette form from the videos that I've seen, but it's in a way where she's had enough experience that she's able to talk about this, and you don't assume that, oh, this must be based on one of her patients. Of course, most people in the world aren't going to assume that anyway, but if you're the patient that story is coming out, you might feel like the whole world knows it's you, especially if it's a very personalized issue. Now, two patients who may have been on the receiving end of maybe a therapist or a psychologist or even a psychiatrist sharing your story on social media and you discovering it, or sharing it in a book or media or to someone outside of you. How did it feel to see your story shared? And on that other perspective, I want to talk about, have you ever had a therapist share someone else's story with you that you suspect may have been a client? And how did that make you feel? For many, it's not just the, oh, that's me. It's, my therapist turned my pain into content. And I feel like monetizing someone else's pain is the issue. It's not about education. It's the issue. Now, if we were in an educational setting, maybe a teaching setting, I think this would be a whole different conversation, but I don't consider certain things educational if you're going to be that specific. I feel like if somebody was to see their pain turned into content, or it's somebody attempting to monetize their pain, that could damage their perspective when it comes to therapy. And it can have a huge impact on whether they seek therapy again, and it can have a huge impact on their mental health. Because let's be honest, some people maybe aren't as resilient as others, or some people really shared something so vulnerable that when they hear their story through somebody who's their provider, it's really difficult to accept that, even though it's not about you and maybe they've put a disclaimer that it's anonymized, that it's not about you. So I'm going to ask one more time, do you think there is a way that this can be done correctly? Should therapists retire case studies entirely as far as sharing them on social media? Should they only stay in the educational aspect? Should they use only fictional examples with no specific identifying details, or should they mash 2 or 3 stories together? Is there a middle ground that possibly I'm missing, or do you think this should just be a no-go all the way? I would really love if you would drop a comment, especially if you've lived through this, below. And therapists, I would really love to hear your perspective too. Again, my name is Jamie, and I am a former addiction counselor. I just want to clarify, I am no longer licensed, but even if I was, I couldn't be your therapist, and I do recommend that if you feel like you need therapy, that you seek out a therapist. That was awful, wasn't it?